It's time for the Dr. Cho Show, the show that helps you understand the latest and safest modern dental techniques for you and your family. You'll become an educated dental consumer and also learn about health trends outside of the dental industry. Here's your host, Dr. Dan Cho.
Hello everybody, welcome to the Dr. Cho Show, your number one resource for everything related to our oral health. My name is Dr. Dan, and I am a general dentist here in Portland, Oregon. I have been also practicing in private practice for about 9 years, and the main reason why I really like to come and kind of get a little bit information. There's a lot of misinformation out there, and as much as I, respect and really do enjoy all of my colleagues and what they've done, I will be the first to admit that there are a lot of doctors out there that communication isn't really their strong suit, and so I'm really hoping to kind of get a little bit more information out there, so anybody who is really trying to understand anything about their teeth, that they can find a little bit of information to, we can hope so that you can overall just make a better, more informed decision. I don't care what anybody says, despite what any insurance company may say. Teeth are not luxury bones; they're critically important. They affect your not only ability to chew, they affect your facial structures. They affect your mental health. And overall health. I mean, there's so many other things, and so that is obviously a topic for a different topic for a different day. And so today I actually wanted to talk about implants. And if you stick with me till the end, I'll tell you how to be able to get a free consultation to be able to see if you're a good candidate for implants. So what are implants? If you're unfamiliar with what they are a biocompatible root form that is a material that's a really, really high quality, medical grade titanium that actually fuses to the jawbone via osseointegration. It replaces teeth. And oh boy, I gotta tell you, they are fantastic in natural dentition. You can pretty much eat, chew. I mean, honestly, in all intents and purposes, you basically get your tooth back. Now, even though implants are considered the gold standard, it's not as quite straightforward as, hey, I'm missing a tooth. Oh, I'm just going to go out and get an implant, because there are very specific requirements that are needed to actually have a successful and predictable outcome for implants. So, we'll talk about those things. And so first, let's talk about the components to an implant. So an implant, there's the actual implant itself, which is the root form that is implanted into the upper or lower jaw, the maxilla, or the mandible, and they are made of, like I previously had mentioned, usually a medical grade titanium or zirconia, which is a type of porcelain. I'm sorry, a type of ceramic, and so. There are zirconia that is very, very biocompatible, that has a lot of really of the implants that are placed are titanium. There's also another component called the abutment. Now this is a piece that actually connects the implant to the crown, and the connection type can also play a large role in the long-term success due to biological and mechanical properties. Lastly, there is an implant crown. The implant crown, is the piece that is visible. It sticks up above the gums, and it was this piece that replicates the form and function of the missing tooth. And so the crown is attached to the abutment, which is attached to the implant. So there are always going to be three components to an implant, with the exception of mini implants, but those aren't. To be honest, they aren't really used very frequently nowadays. So most people are going to be getting kind of the full-size implant, and so. Let's go a little bit into the requirements for a dental implant. There are several requirements for a patient to be actually clinically eligible for implants, and so the main requirement is for there to be adequate and sufficient in bone to be able to encase a large enough implant in vital bone. Implant sizes can range anywhere from as short as, honestly, really about 6 millimeters, which is honestly a little bit too short in my opinion. Really, it should be anywhere from 8 up to 10, 12, 15 kind of millimeters, depending on several factors. So there are guess general rule of thumb for it is the larger the implant, the kind of the better. Up to a certain degree, if there's not enough room or space to be able to put a 6 millimeter implant, you can't put a 6 millimeter implant. To give you also a little bit of, um, you, you know, I guess reference, a 6 millimeter is a pretty big one. Typically, a lot of the implant sizes are usually about maybe 6 millimeters, but a 6 millimeter is a pretty big one. So in addition, there also needs to be enough space for the actual crown itself in the interarch interproximal dimension. What that means is within the same arch, and to make sure there's actually enough tooth between the two arches, the top and bottom jaw, because what can happen is that space can overall be reduced, and or another tooth can kind of drift down into the space where the tooth was missing, and if there's not enough space, something needs to be done, whether or not the existing teeth needs to be move the orthodontics, or have a crown prepped on it, but there has to be enough room to be able to place for it. So, and lastly, there is also the kind of a general requirement for essentially to have a healthy mouth. There are, while you can technically put implants into a mouth that has a lot of implants into a mouth that has a lot of decay, periodontal disease, it's just really not a good idea. It really increases a lot of the risk factors that can really make an implant fail. And lastly, the patient has to be healthy enough to be able to actually undergo the surgery. Now, the surgery is not really, it's not like open heart surgery. It's not like you're getting put, completely into general anesthesia, having your heart open, that sort of thing. But it can put a stress on people, and it really, the patient that's undergoing any type of surgery, even if it's as small as a biopsy on the gums or something like that, the patient should be healthy enough to withstand the type of surgery. So I mean, those are kind of really in a nutshell what is necessary, and I've kind of really oversimplified it. There are some other components that overall make the implants kind of a little bit more complicated. Other components that overall make the implants kind of a little bit more complicated. But the basic rule of thumb is, if we can really simplify it, and I really am a big fan of the the KISS method. Keep it simple, stupid. There essentially has to be enough room in the bone and inside the mouth to be able to put an implant, and the patient has to be healthy enough. Now, there are some other factors that also play into, I guess, how predictable an implant is, or how long it'll survive. Some of those other risk factors include the age of the patient. If there's any diabetes, smoking, a history of a head and neck radiation, menopause, hormone replacement theory, the quality of the gum tissue, the size of the implant as well, and also whether or not there's any pathology. And there are also some studies that have shown that there's really not a significant correlation between osteoporosis and early implant failure. However, it is also another risk factor. Treatment for something called BRONJ, or bisphosphonate-related osteonecrosis of the jaw. Basically, what it means is that any type of a surgery, there's a lot of necrosis or death in the actual bone itself. It's a pretty nasty complication. So, while if you have had osteoporosis, it doesn't necessarily mean that it will completely exclude you from getting, being a candidate for an implant, but you just have to understand your risk factors. And I should also go back and mention that, these things, like, if you are somebody who's diabetic, if you do smoke, it doesn't necessarily preclude you from actually being a good candidate for the implant. You just have to understand and set the expectation that, hey, the implant itself may not go swimmingly, may not go perfectly, and just as long as you and your dentist are happy or okay with that, you have to understand the risks going in. Also, like I promised, if you wanted to find out and get a free implant consultation here in the Portland area, this is how you can do that. Reach out to us, info@lifebloomdental.com. That's info at lifebloom dental.com. Or you can give us a call, 503-646-4600. Again, that's 503-646-4600. You can also go onto our website, portlandsdentist.com. That's Portlands with an S, dentist.com. And, just say, hey, I heard you about the podcast. I'd like to try to get a free, implant consultation. Be sure that you do mention the podcast so that we can make sure that it is free for you. So if you do have any questions, if you want to hear a little bit more about this, obviously come out and reach to it. And I hope that this was helpful. And, we'll find a lot of other topics to kind of really discuss. Until next time, I hope you have a wonderful day, and we'll chat soon. All right, have a good one.
Thank you for listening to The Dr. Cho Show. If you have any questions for Dr. Cho, you can reach him at www.portlandsdentist.com or by calling his office at 503-646-4600, or feel free to send him an email at info@lifebloomdental.com.